me? Can you hear
Yes,
me?
yes.
Yes. Thank you very much for inviting me as a speaker to the third edition of Yoga Global Conference on Pediatrics and Neonatology 2021. And I would like to offer my special thanks to the organizing committee members of the Magnus group. As I think I am somewhat different fix, I feel that you are in different forum because it's Western medical system associated, but I am the one, I think only one who are going to discuss about the Ayurvedic approach on management of cerebral palsy. I am a senior lecturer in Ayurveda Pediatrics Institute of Indigenous Medicine, University of Colombo, and I have completed my master degree under the Ayurvedic Pediatrics and PhD University of Sri Jayawardhanapura, Sri Lanka, and I am the senior most Ayurvedic consultant pediatrician in National Ayurveda Teaching Hospital. Today, I would like to share my knowledge regarding to the Ayurveda concepts and the Ayurveda approaches on management of cerebral palsy. I think as you are a separate forum, I would like to discuss that Ayurveda. Ayurveda is an ancient, authentic medical system which has been originated in India more than 5,000 years ago. And in Sri Lanka, it is being practiced with, we have a special Sri Lankan traditional medicine, and which involves historical and currently operate as a Sri Lankan Ayurveda with distinct identification from Indian Ayurveda. They are separate, but we have Sri Lankan traditions also mixed with the Indian Ayurveda. The term Ayurveda is derived from two different words. Ayur means it's life, and Veda means science of knowledge. Hence, it is a science of living. So Ayurveda emphasizes a good health, preventive measures, and treatment of illnesses through lifestyle practices. Normally, we use herbal remedies to overcome those things. Other than that, Ayurveda medicine is holistic, and which means that viewing the body and mind as a whole. So we are discussing under our concepts as when I discuss the cerebral palsy, I know that topic will very familiar with you all. Cerebral palsy means brain paralysis. It's a disability that affects movements and body positions. It can be occurs before, during, or just after birth. It is caused by damage to the motor control centers of developing brain, and we can be compared with the Shiromarma because it has clearly mentioned under the Ayurveda concepts. Although these diseases appears as a new diseases, but we have discussed in before 5,000 years before all the diseases, but directly, without directly, all the signs and symptoms are discussed under the concepts of Ayurveda. It is a non-progressive disorder of posture, movement, and coordination, often associated with conversion, mental, visual, and hearing impairments. And it's also associated with mastodontia. The symptoms develop over the first few years of life and gradually do not worsen thereafter. But there is one-to-one correlation available in Ayurvedic classes with CP, but there are many conditions and some cost factors linked to the etiology for such type of disease condition described in many chapters in different authentic texts before 5,000 years ago. Some conditions which find an overlap of symptoms of CP include Pakka, it's a kind of nutritional disorder, and Pangulya, it's locomotor disorder, Mukhatva, dumbness, Jadatva, mental disorders, Ekangaroga, monoplegia, Sarvangaroga, quadriplegia, Pakshagat, hemiplegia. These are the things, some conditions which find an overlap symptoms of CP. In Sri Lankan researchers have developed correlation with the condition of the cerebral palsy and Balaka Pakshagata. Balaka means that baby and it's pediatric part, and Pakshagat associated with that quadriplegia, monoplegia, that kind of diseases we have mentioned, we are discussed under the Ayurveda Vata Vyadhi. It's mean that neurological disorders. Most of in Sri Lankan research, we have developed correlation in our research comparing the etiopathogenesis and signs and symptoms of birth conditions. So prevalences. Annual incidence of CP is 2 to 2.5 children per 1,000 birth. There are about 50,000 cerebral palsy children are recorded in Sri Lanka. 70 to 80% of CP cases are acquired prenatal, and 10 to 15 of CP is acquired through non-brain injuries. Infections are traumatic, traumas after first month of life. Because of that, most of the children come in search of our Ayurvedic treatments for this kind of chronic conditions such as that cerebral palsy, autism, and ADHDs, and muscular dystrophies such as the DMD, BMD likewise. So chronic conditions, they are searching, come and search our Ayurveda treatments. So we develop our treatment plans according to the Ayurveda concepts. CP is associated with the developmental abnormalities. So we have discussed that under the Samvardhana Vikurti, I have used some Ayurvedic terms. I don't know whether it is, that is why I try to use English words according to that. The main complaints of parents whose children are affected is in growth and development according to their proper age. Sometimes they have that motor functions, gross motor functions, fine motor functions delays. So they are complaining about the speech difficulties likewise, as you all know. And when we discuss about the etiologies of CP, according to the Ayurveda point of view, we have divided into 4 groups, especially Garbha Purva Nidana, it's mean preconceptional causes, Garbha Kalina Nidana, prenatal causes, Prasava Kalina Nidana, perinatal causes, and postnatal causes. Under the preconceptional causes, some conditions I have already discussed under the Western medical system. So, but some others we have only discussed in our concepts. That consanguinity marriages, Tulla Gotra Viha, these are the main points that discussed under the Ayurveda. Preconceptional causes can be associated with cerebral palsy, chromosomal and genetic abnormalities. It means bija dosha, problems in genital organs, ashaya dushti, and disorders of time, kala dushti, and past action of previous life. I wanted to discuss this because these terms are somewhat different, but consanguinity marriages under the preconceptional causes, that Tulya Gotra Vivaha, it helps to continuation of, according to the Ayurveda classics, it helps to continuations of familial running disorders like as that Manovikurti, mental impairment, and conversion, such kind of conditions. And chromosomal and genetic abnormality, it is clearly mentioned under the Ayurveda, Bija Dosha, Bija Bhagat Dosha. It's chromosomal and genetic abnormalities considered to be one of the cause for tetralogical abnormalities as well as in Western medical system. And problem in genital organs, especially vitiation of Shestra, Garbhasha, especially uterus, may lead to deformities of child. Other than the disorders of time, age factor, it is very clearly mentioned under the Ayurveda. Age factor will be the problem, the pregnancy factor, parents' age factor will consider the disorders of abnormalities made to the babies. As past action of previous life, Atma Karma, I think this words is not mentioned in your Western medical forum because Akruti, growth and intellectual faculties, development depends upon the Rajas, Tamas, and Atma. It has clearly mentioned past action. So I know that unknown etiologies of cerebral palsy can be included to the Atma Karma Dushti, which has already discussed under the Ayurveda concept. It's clearly mentioned we have bring all the past actions with our Atma, and it will make the developmental abnormalities to the child. Other than that, prenatal causes, Garbha Kalina Nidana, improper antenatal care. under the improper Garbhini Paricharya, it's clearly mentioned its foods, activities, and associated health conditions will be the problem. And non-fulfillment of longing, that word also not come with associated with the Western Medical Forum, and infections and infestations, creamy, trauma and smoking. These are the things that they have already discussed under the Ayurveda concepts. Improper antenatal care means normally it's unhealthy foods and activities and associated health condition, especially pregnancy period associated condition, the pregnancy-induced diabetic mellitus, pregnancy-induced hypertension, and mental status of pregnant mother. So those are well associated. These are the things that they can cause Pangu, Kubja, and the likewise the disorders. It's associated with the developmental disorders in children. Non-fulfillment of longing, it's Dauharda Apachara. It means that non-fulfillment of longing during the pregnancy may lead to both growth and developmental abnormalities. It is clearly mentioned after the 4th month, it's Dauharda mean 2 hearts, that's baby became we have to fulfill the mother's pregnancy longing, so that if it is not non-fulfillment, it will create the abnormalities of children. Infectious and infestation, creamy, prenatal and natal infections, under that you have already discussed those conditions. And traumas, abhigata, internal traumas and external traumas can be lead to damage to the fetus. Smoking also, it has clearly mentioned under the Dhupapana in our Ayurvedic concept. Child may become visual impairments and impairments of development. Likewise, it has clearly mentioned. So other than that perinatal process, under the perinatal causes, it has mentioned under the Prasava Kalina Nidana, prolonged and weak uterine contractions, Vilambitavi, strain without true labor pains, Akala Pravaha, head injuries during the labor, Murda Bigata. These are the things that are already discussed. Because of the prolonged and weak uterine contractions, delayed the process of delivery, it creates the mother get distress, the fetus can get asphyxia. So it may be the cause for the CP. And also that other than that, normally that injuries, because of the Akala Pravaha, injuries to the cranium, brain damage, it creates the Shiromarma Bigata, especially brain damage, it's created to the CP. Head injuries during the labor, Murda Bigata, instrumental delivery, it may be the cause for the head damage. So delayed second stage of delivery, because of that ischemic encephalopathy or Shiromarma Bigata, it may be the cause of CP. These are the things. Other than that, postnatal causes, it's clearly mentioned under the Ayurveda. The postnatal period is started just after the baby born. Proper management is necessary for the baby after the birth. So under that, improper resuscitation, disorders of breast milk, supernatural causes, and other health problems. So under that, I want to just touch those things. Improper resuscitation, delayed prana pratyagamana. It's clearly discuss how we maintain those prana pratyagamana according to the Ayurveda concept. Delay is respiration with poor FGA, ventricular damage in brain also create the CP. Disorders of breast milk. I think this part is not discussed under the Western medical system as a causative factor of CP, but in according to the Ayurveda, we can correlate those things also. Male stan vitiated mean that breast milk vitiation by kappa. I don't want to discuss because this is our fundamental theory is very difficult to discuss here, because it is very large topics. Infants may cause kapha vruddhi, that because our main fundamentals vata pitta kapha, so those blocking the rasavaha shrotas, manovaha shrotas, it's create the impairment of growth and development according to the concepts. And also effect of graha, supernatural causes, those are, I think those things you don't want to discuss because it's not mentioned in your, but in clearly I read the concepts, it's mentioned that there are skanda apasmara mesha, that kind of supernatural causes can be impair the growth and development of child. Effect of nature and Nagantuja disorders, other acute and chronic health problems. So fever, anemia, diabetic mellitus, likewise that conditions. So it will create the impairment of growth and development. So these are the associated signs and symptoms. It is clearly mentioned in Ayurveda. Some portion is limb contractures, limping, muscle atrophy, spasticity, especially Shesta, that sometimes that spastic quadriplegia, spastic move. It means that decrease the movement, increase the abnormality, abnormal movements also, some babies associated, and Gati Vikruti means gait abnormalities. These are the some signs and symptoms mentioned in Ayurveda authentic text. So these are the comparisons of cerebral palsy and Vata Vyadhi. So according to the Ayurveda, cerebral palsy, there are especially 3 types: spastic, hemiplegia, diplegia, monoplegia, and quadriplegia. So we can correlate Vata Vyadhis according to the Ayurveda. These are the correlations mentioned under the Ayurveda. Here I wanted to discuss Sri Lankan established Ayurveda treatment regimen for management of cerebral palsy. Normally, here we have used special Ayurveda measures, use Medhi Rasa internal treatments, and especially Panchakarma treatments mean purification method, as we have used external treatments. Medha Rasayana means that normally drugs have the power of improving the brain functions. However, considering the symptoms and etiologies of the disease, I have discussed with you that it is clear that there is some correlation between the Ayurvedic concepts and the modern concepts on cerebral palsy. Now we are going to discuss how we are develop our treatment regimen. Under the Panchakarma measures, external therapies, we have used massage therapies, especially Hastapada Shiro means that head, legs and hands massage, Shirodhara, Shirovasti. I will discuss it later with the photographs. Normally we have used treatment regimen. It's 2 part of treatments. Outdoor treatments, we will give the outdoor treatments, internal drugs, as well as the external treatments, oil massage, body and the head massage. After baby get outpatient treatments, initiates the residential treatment based on the child's well-being. So after that, we start the indoor treatments. These treatment regimens also established. This is the publications regarding to that. Major drugs. Normally, our treatment regimen, internal treatment regimens, is 3 rounds of treatments with 45 days, each round with 2 months gaps for major drugs that we have used normally in established Ayurveda treatment regimens, especially Manduka Padni, it means Centilla asiatica, Brahmi, Bacopa, Monaria, and Madhuyashtimum, Glyceria, Glabra, and Vacha, and Ashwagandha, across Calamus and Vitania, Sominifera, we have used as a powder for the preparation. Other 3 drugs, other 3 ingredients we have used as a decoction in Ayurveda treatment regimen. These are the clinical and experimental studies of Mandukupani, Centilla asiatica. We have used that because it has anti-convulsion, anti-stress, smooth muscle relaxation, neurological regeneration, antispasmodic, sedative, antidepressive, reduce learning deficits, intellectual improvements, and improve the behavioral changes. Normally, these drugs we have used not only the CP management treatment regimens, but sometimes that Centilla asiatica we have used for the autism and ADHD treatment regimens also. And also that clinical and experimental studies of Brahmi mean Bacopa, Monaria, Brahmi, that name also include brain function improving signs and symptoms. Likewise, that it gives the comments and smooth muscle relaxation, anti-convulsion, improve the memory, improve the learning capability, and antioxidant, and anxiolytic, antispasmodic actions it has. Other than that, clinical and experimental studies, Madhuyashti. This is the third drug we have used for, especially for the CP babies without conversion. So if the baby has conversion separately, we have used separate treatment regimen for internal treatments. It is also neurotonic, intellect promoting, analgesic and antioxidant effect it has. Other than that, we have used that across calamus, washa as a powder, anti-conversion, sedative, antispasmodic, and analgesic effect it has. And other than that, clinical and experimental of ashwagandha, vithania, somnifera, anti-conversion, anti-stress, sedative, memory retention power, immune stimulatory, anti-inflammatory, and antispasmodic. We have used these regimens according to our pharmacopoeia, our authentic texts, because it has pharmacodynamic properties, improve in the especially brain functions and brain memories, as I discussed here. These are the established external measures throughout the treatment regimen. We have used Shirothaila Abhyanga oil massage, head massage. Shirodhara means I will discuss that because it has 7 days Shirodhara, Shirovasti 7 days, Sarvangadhara 7 days, Sweda, sedation, Pinda Sweda 7 days, Virechana, and it's purgative therapy. It's normally used that I don't want to show this because Virechana purgation therapy eliminates of vitiated dosas according to the Ayurveda concepts through the rectum is called the purgation therapy, especially powder, Datri powder. It's normally we have used that powder expecting the purgative action for 3 days. It has light purgative property. And other than that, Vasti mean enema. So the term Vasti is given due to the administration of medicated drugs into the rectum. Anuvasana Vasti means that now, especially we have used oil for the study during the 7 days. These are the treatment regimen. Shirodhara. Shirodhara means that normally we have to use 7 days Shirodhara treatments. It's come for 2 Sanskrit word. Shiro mean head. And Dara means implies to pour in or sprinkling something, especially together in infers to the dripping or pouring of warm herbal or Ayurvedic oils onto the forehead from a specific height for a specific time period in a continuous. It's depend according to the baby age and time, a certain period of time. It's also depend according to the age of the baby. And other than that, this is a Shirovasti. It's a special hat, preferably that made of leather, is fixed around the head, just above the ear and eyebrows, and the joint between the head and hat is make leak proof. So one onto this position that normally that hat lukewarm oil is poured and allowed to remain certain prescribed time. So Murda Thaila is called Shirovasti. Babies, we have to, especially if the baby is around 2-3 years, so we can keep it around 20 minutes. It's also depend according to the baby's age. Other than that, Sarvangadhara, it's warm medicated oil. It's systematically massage on all parts of the body as the patient lies on Ayurvedic therapy bed. So this is the oil massage. And this is the Pinda Sweda. It's clearly mentioned that Pinda Sweda, we have used that name, Shashtika Shali Pinda Sweda. It's Shashtika means 60, denoting rice that measures in 60 days. We have prepared milk rice with using decoctions. So that is Shashtika means that 60 denoting rice that matured in 60 days. Shali mean rice. Pinda implies a bolus of bag or said. Its name of the sedation therapy. Normally that most of the external treatments such as Shiro Abhyanga, Shirodhara, Shirovasti used in the Ayurvedic treatment regimen has the power of improving the brain functions. And other than that, Abhyanga massage, Sarvangadhara, Pinda Sweda, likewise those treatments good effect to reduce the body stiffness and contractures, and help to maintain the muscle strength also. These are the things we have used. We have used assessment criteria. Normally, for CP have been described with age group. Normally, we have used international assessment criteria, GMFCS, gross motor function classification system for cerebral palsy in our ward. Also, it's described with age range up to 2 years, between 2 to 4 years, between 4 to 6 years, and between 6 to 12 years. As I feel you all know these criteria. So before starting the treatment for the children, they were assessed by using the assessment criteria of GMFCS. And then patients were categorized according to the levels of their conditions. After completion of the treatment, they assess by using GMFCS again, compare the pre-treatment and post-treatment levels. According to our treatment, our assessment, after the treatments, most of the affected babies before 3 or especially before 2 years or 3 years received good progress than the older babies. So normally we should, therefore, the treatment should start as early as possible. According to our finding, it should start as early as possible because brain developmental stage is somewhat early, so we should start as early as possible. Nowadays, that Western medical systems, they also refers to patients in Sri Lanka to our the treatments because it has already proven that effectiveness of this treatment regimen. So finally, I would like to discuss that signs, symptoms, and etiologies described under the system of Ayurveda can be correlated to a certain extent with the signs, symptoms, and etiologies of cerebral palsy described in modern system of medicine. Ayurvedic treatment has been practicing since 2008 in Sri Lanka. Therefore, the effectiveness of Ayurvedic treatment regimen on management of cerebral palsy can be seen. Further studies are proposed. Normally, that when we have already done the research with the physiotherapy group also, so we have identified that the treatment regimen is much better than the physiotherapy groups. That, but all together, evaluate the efficacy of combined therapies, especially Ayurveda, allopathy, and homeopathy for the management of cerebral palsy is compulsory to develop our society. These are the other Ayurveda research management protocols related other publication in India. Also, they have used several modalities for the management of treatments. These are the other publication related to the Ayurveda treatments regarding to the cerebral palsy. And I would like to, finally, I would like to tell you my view regarding to that. Ayurveda, allopathy, and homeopathy are widespread in society where the primary goal of this medical system is achieving a healthy life. If we use the combination of these therapies without distinguishing Ayurveda, allopathy, or homeopathy will help these babies as well as lifelong suffering parents to take a better improvements of their children's conditions. Thank you. Thank you very much for giving this kind of opportunity to share my knowledge, and I would like to appreciate that all the presentation I have gained good knowledge, and I would like to make that correlations and make our knowledge share with our research work future also. Thank you.